morning.
Good morning.
So, did you guys have issues getting into part of your content this week?
No.
Because when I went to look, what you guys had done this week, it looked like the majority of you didn't have anything done for STIs, like you were having trouble getting into it or something.
What for ATI or which one? What website are you talking about?
I'm talking about the Realize It stuff.
I don't think we had issues with it, but if it shows on your end that it's still like that, you can always let us know.
Well, you were the only one that I saw who was in it. It was like no one got into it at all. But did you guys actually get into it okay?
I got into it okay.
Well, I know you did, Gloria, but I'm talking about everyone else.
Yeah, I did too, but the only problem I saw was like the unit two. There was an extra content that was added, but it wasn't giving me access to that content. That's the only thing I saw.
But
But
then later on in the week, you could get into it then?
um let me check now. I'm not sure.
I was just wondering because, I mean, I just want to make sure everyone can get into everything they're supposed to, you know?
Mhm.
So Lisa said she was able to do unit two, but it kept saying she only did 5 out of 6 things when she did everything. So maybe that's what it's doing for everyone then.
Yeah, that's what it's doing for me too. The
Okay.
other six is not letting me, get access to that six content. If you click on it, it says there's no content for that one. So I only did 5 out of 6.
Okay. So when you don't see a thing that says STIs, or you do see that, but when you click on it, it won't let you get into it.
Yes, I see the FCI, but it won't let me get into. Oh, it's working now. Never mind.
It
It
is
was,
working now?
it's working now. Yeah.
Okay. Yeah, I don't know what the deal is with that. I'll ask someone about that today. But anyway, if you guys didn't get into that earlier on in the week, make sure you check so that all of your stuff's done so you get your full amount of points.
Hmm.
Hey, Cynthia and Stella, since you guys just got in here, we were just talking about the Realize It content for the week. I was asking everyone else if they had trouble getting into the STI content. What did you guys do this week with that? Did you have trouble getting into it as well?
No, I got into it fine.
You did? Okay.
I did too.
Okay. It almost seems like there was an issue with it earlier on in the week, and like when people were trying to click on it, it wouldn't like take you to your content. And so there's a bunch of people who did the whole unit too, but except for that because they couldn't get into it. So then I don't know if there was some kind of problem and someone fixed it. So now, like when you get into it today, I think it's working all right. So I'm just saying it to everyone. So if you didn't get into that for some reason, make sure you go back and look at it now so that you can get your full amount of points. Okay.
Wait, what is STI?
Sexually transmitted infections.
Wait, is what?
It's called sexually transmitted infections. Okay, I think everyone's in here now. So for those of you who just got in here, I'll just say it one more time just to make sure no one missed what I said. So I was asking the rest of the class if people were having issues getting into Unit 2's content for Realize It. Most of the people got into like 5 out of the 6 things. So I was wondering about the 6th thing, which was the content about sexually transmitted infections. A lot of people seemed like they didn't have that done, so I was just wondering if they were having issues getting into it. The beginning of the week, I think there was some kind of problem with it because people are saying that they were trying to click on it and it wouldn't take you to the content. So I think it's fixed now, and I think you can get into everything now. So I'm not sure what happened there, but if you ever run into that in the future, make sure you try to tell me about it earlier on in the week so I can, ask someone to fix it so you guys can get into it. But anyway, just make sure that if you didn't do that, that you go back and get into it, today or tomorrow so that you get your full points for the week. So this is the other thing I wanted to say. I talked to this lady from Wisconsin, and she was telling me that she thinks I should change my due dates for the weekly stuff that you guys do. So because our class is on Fridays, she thinks that our due dates should be Thursday. So I think I might do that for this coming week, for week 3. So obviously, for week 2, it still stays the same. It would be Sunday that would be due. But for next week's, for week 3 and the rest of the time, I think I will change it to Thursdays. So just be aware of that. So day before class, you need to have all of your content done so that you're ready for whatever we discuss in class. Is everyone okay with that?
It would be due Thursday, 11:59 instead of Friday
Correct.
night. Okay. Yeah, that's fine. Also, with the Realize It, the STI one, so basically I did it, but I think it made you do the 5 previous objectives first before that one popped up. At least that's what happened for me. So because it was all the other objectives were in a line and they were connected, and then STIs was on top. It was
By itself.
going separate. Yeah. So it made you go through the whole map, and then it popped up at the end.
Okay. All right. I just want to make sure everyone was okay with that stuff because I don't want you guys to not be able to get your points. So this is the other thing. So with the points, every week, you do your stuff for the week, and then if you do it by the due date, I have to go in and there's this blue button that I have to hit to submit everyone's content that they've done, and then that automatically gives you your points. So I think it's on our syllabus, how much everything is worth. So there's how you get 2 point whatever for your grade for the week. There's something that they multiply that by depending on how you did in the content, and that's how it gives you your points. So anyway, did you guys have questions about any of that kind of stuff? Or are you okay with that?
I think I'm good with that. So basically, when you get the green star or whatever, that basically means you're good in that area, right?
Yes.
Okay.
Oh, and so this lady was telling me some other stuff because I don't know that much about Realize It either. I'm kind of learning like you guys are. She was telling me that when you take your first test, so you guys, say you go through all of these modules that we do up until the first test, and you have green stars and everything, right? So if you go onto the test and say there's, I don't know, content about STIs that you get wrong. If you had a green star in that before the test, now it's not going to be there anymore after the test. It'll force you to go back to review that stuff because you missed it on the test. So your stuff will change. It'll look differently after the test according to how you did. So don't be surprised if you see that, okay? All right, so our content today was just supposed to be about, it looked like pain and palliative care, and then the STIs, I believe. So I was going to ask you guys, how much do you guys know about PCA pumps?
We briefly talked about it in like farm, just kind of like what the concept of it was, but like not like super in depth with it.
Okay. So I just kind of wanted to talk about it a little bit with you this morning, just so you know more about it. And then I just now, before I got on here, I posted a video onto your announcements. I'm not going to play it for you in here because I can't seem to play videos for everyone because they never can hear. So anyway, the video you guys can watch on your own, and it's, I don't know, it's like 15 minutes or something. It's a little bit longer, but it's kind of a good video. So you guys can take notes about this if you want. I'm just going to just talk without, I don't have something to show you about it. I'm just going to talk. All right, so if you're working as a nurse, like say you're working in a nursing home or a hospital and someone has a PCA pump. So there's going to be times where you have to set up everything, you know, for the first time, like it's a new order and you have to set it up. Or there might be times where you just come on and someone already has one hooked up and you have to, you know how to take care of it. So anymore, a lot of the hospitals have the smart pumps, which the smart pumps are great. They do so much more than the old kind of pumps did. So the video that I put on has to do with smart pumps. It's a little bit about that. So it talks about like the smart pump itself and then how to hook up the PCA pump and all of that to it. So for you, some of the stuff that you need to know is that when you have an order for a PCA pump, your physician will specify exactly what kind of settings he wants on this PCA pump. So there's a couple different ways you can do it. So you can set a PCA pump so that this patient gets a certain amount of, like say it's morphine, like they get a certain amount of morphine every time they hit the button. And there's a certain time period that they have to wait in between, you know, getting that. So like say, I don't know, say I had a PCA pump and I'm getting 1 milligram of morphine every 10 minutes. You know, that could be what your setting is at. So for this person, every 10 minutes they can push this button and they'll get that 1 milligram of morphine. So they only get the medicine every 10 minutes if they push it. So like if they fall asleep or something, you know, they will be without it for a while. So that's that setting. There is also another setting that you can do where not only would they get it, you know, 1 milligram every 10 minutes like that, but you could set it for a continuous dose as well. So like maybe I would have, I'm just throwing numbers out there. So maybe I would have 0.5 milligrams of morphine that I get continuously without me having to push the button. But then in addition to that, I could get another 1 milligram of morphine every 10 minutes. So the way that the pump is set is going to be specified by your physician, and then you have to go ahead and program it that way. So for the patient, you know, the patient will have their button that they use, and depending on the pump, you know, different pumps from different companies do different things, but like the one in the video that I posted, this one has like a light on the button. So like when you push the button, it'll show you when you're getting your dose or when you're due for your dose according to the light on it. It's kind of nice. So anyway, if the patient tries to push the button before their time period is done, so like say it's only been 8 minutes instead of 10 minutes, but they push the button, it won't do anything. It won't give you anything. And then, so it has like, you know, safety features to it, so you can't overdose and all of that. So a common thing that a lot of people like to ask you about the, yeah, I see you guys. I know you're asking about the math exam. Yes, we're still going to take it. I just wanted to talk about this real quick first. Anyway, so a common thing that people like to ask you about PCA pumps is that What if your patient is, they have family members in the room and the patient falls asleep and the family member pushes the button for them? What are you supposed to do with that? So what happens is no one else is supposed to push the button except for the patient. So, if the family members are doing it, what do you think could happen?
There's going to be a
Mhm.
toxicity because if it's not needed, why do it? And it's only the patient who can tell whether they need the medication or not.
Exactly. So typically in these types of questions, like the family will be like, "Oh, well, my mom, she's really usually in a lot of pain. So if I don't push the button for her, she's going to wake up and be in excruciating pain." They'll always have some kind of crazy reasoning for it, but that's always just not a good thing to have anyone else push it except for the patient. So when you read about PCA pumps, they usually say, make sure you tell your patient that they need to tell you if this isn't taking care of their pain anymore. So at some point, maybe it's just not appropriate to have them hooked up to the PCA pump now and you need to do something different. So for your purposes, that's something just definitely to remember, that the patient's the only one to push it, because if someone else pushes it constantly, then like she said, maybe you get this patient toxic on the medication and then maybe they have like respirations of 6 or something, or 4, like they quit breathing because you're pushing it too much. Respiratory depression's a really big deal here with some of these pain medicines, so you have to be really careful with that, right? And then a couple other things I just want to say real quick before we take the math test about this. So with these PCA pumps, typically you're either going to have morphine or Dilaudid in your PCA pump. And usually it's going to be like a big syringe of it, usually about 60 milliliter syringe that you put inside the pump. So at the beginning of the shift, you are supposed to check this with the nurse that's leaving, when you get your shift report. So the person that's going off the shift and the person's coming on the shift need to go check the pump together. So there is a button on there that you can push to look at the history. And when you look at the history, it'll tell you what the settings are in the pump, so you can double check and make sure you have the correct settings. You can also see how many times the patient has pushed the button over the past so many hours to see, like, do they really need this, or, are they doing it appropriately? It tells you all kinds of stuff in that history. On that video, I think the button is called options that you click on the smart pump. So if you hit options, it'll show you like the history and stuff. So anyway, beginning of the shift, you do that just to double check everything. And then also, I don't know if you've thought about this before, but for intake and output, this is part of that, the PCA pump is. So you would have to see how much of that morphine is left in the syringe in the morning when you first come on. So you would write that down. And then at the end of your shift, when you go off and the next person comes on, you do it again. And that way you write down what's in it at that point, and then you subtract from the number you wrote down at the beginning of your shift to the number you wrote down at the end, and that's how much you would put in for your intake. Does that make sense?
Yeah, it makes sense.
Yeah, so a lot of people don't think about that kind of stuff when you think about this, but that's something that you definitely need to be doing when you take care of anyone with a PCA pump. You always have to check the pump at the beginning of the shift and at the end of the shift with 2 RNs. So just remember that too. All right. Did you guys have any questions about your math? Do you feel okay with your math, so we can go ahead and get that out of the way?
Yeah, just a quick question. I know there was like the IV like milliliters per hour questions, but is there gonna be any drops per minute or no?
Everything that we looked at last week would have been everything that would be on there. So if
Okay.
there was nothing like that on there, then you wouldn't have that.
Okay.
Okay. All right, let me go to the other screen so I can find the test. Do you guys? I'm not gonna. Do you guys care if I get in land school or not for this?
No.
I just don't feel like it this morning, so I'm just gonna give you your code and you guys can get in and do it. Okay.
Did you open the exams yet? Because I don't see it.
I just did. Give me 1 second. So it's going to be under quizzes. So when you guys are done with the exam, then I can open up more stuff so that you can go back in and look and see if you got something wrong or not. But right now it won't tell you that, okay? So you'll have 30 minutes to take this. And here is your code. I'm going to put that in the Zoom chat here.
Are you gonna stay on Zoom? Like, what are we doing after? Are we coming back on here?
Yes, so after you're done with this, just go ahead and stay on here. We'll wait for everyone to get done, and then I'll just do a little bit more with you, and then we'll get off here, okay? I'll go ahead and mute myself. If you need something, obviously, I'll still be able to hear you, but I'll mute myself so you don't have to listen to me while you're taking this.
We can start, right? Okay.
Okay, it looks like everyone's done now, so I'm going to go ahead and open up the math test so you guys can look at it more. Just give me 1 second. Okay, I changed the settings so you guys should be able to go back into your test to look at what you did and what you got wrong and what you got right. If you have a specific question about something, just ask me and I'll see if I can figure it out for you.
Can we go over the Army time one, military time one?
Yeah. Here, let me see if I can pull it up. Let's see, which one was that? Is it this one, number 9, that I have on the screen here? Is that the one you're talking about?
Yeah.
Okay. So with this, it's just saying that you have, you know, a bag of fluids up that's infusing at 125 milliliters an hour, and it tells you a starting time, and it wants you to know when it's complete, and it's asking you in military time. So I think on yours, you kind of had the right answer, but kind of not, because you didn't have the military time right. So when you're thinking military time, if you think of your regular clock, you know, so if you go from 12 to 1, so 12 o'clock would be considered like 2400. 1 o'clock, you know, if you're thinking like 1 in the morning, it would be 0100. And you kind of go from there. So when you go get into the PM times, like if you're talking 1 p.m., that would be 1300. 2 p.m. would be 1400. You kind of go on from there.
Oh, so I just restarted it
Yeah, yeah,
like a regular clock.
yeah.
Okay.
Okay.
And then it's one like I got it right for the other one, but can you just scroll so I can see?
Yeah.
Okay, that one right there.
This one?
11.
11.
Was I supposed to divide it by the 50 instead? I divided it by the 100.
Yeah, it was supposed to be the 50.
Okay.
So basically, you just change this 1 gram to milligrams. So that would be 1,000 milligrams, and you just divide it by 50, and that would give you your.
Oh, okay.
Yeah.
Okay.
Okay.
Thank you.
Uh-huh. Anyone else have any questions? Okay. I think you all pretty much did really well, so I don't think we have any issues. So that's good. Yay. All right, let me stop sharing that a minute. Okay, so the rest of the time, I thought we'd try something different, you guys. So because we have that sexually transmitted infection content, I thought it might be cool to try to break you guys into groups. We have this thing, I don't know if you noticed this at the bottom of the Zoom thing. It says something about breakout rooms. Do you guys see that? Or maybe it's just on mine, I don't know. I don't know if you guys see that or not, but anyway, so what it does is I can break you guys into groups, and then you go off into your own room, and it's just you in that room. And so you guys can talk and collaborate about whatever, you know. So for this, I thought it might be beneficial to all of you for us to, like, when you break into groups, I'm going to assign each group one of these STIs to look at specifically. And so, like, say yours is chlamydia or whatever. So I assign that to you, and I want you guys to do a concept map on it. And I have a, let me see if I can post this on the Zoom chat. Hold on 1 second. I have a program here that you might be able to use. Then I'm going to see if I can post the thing for it. I think it was this one. Yeah. So see if you can, oh, whoops, I just did that privately. Hold on, let me do it to everyone. See if you can go to this website. And when you go there, there is, you can do it free. There's nothing you should have to pay for or anything. But on here, it's called Creately. And when you get in here, there's something that says enter your work email and start drawing. If you want to do it that way, you can. But they have different things inside here that I think would be helpful. If you scroll down, there's a spot that says education. And if you get in there, if you go down a little further, it'll say primary education. It'll show you a bunch of different templates. And keep scrolling down. And towards the bottom, there's one that says nursing concept map. So I think that would be beneficial for us to use that. And then it says edit this diagram. So if you could get in there and do that, I think this might be really helpful. We could do this right now. So I'm going to split you guys into groups of 2, and I'm going to give you one of these STIs to look at specifically. So you are going to either, you could use your textbook if you want to get in there and look specifically about this, or you could, I posted the PowerPoint for this, so you could look at the PowerPoint if you want. That's under modules for under Unit 2. I put that in there. I think it's chapter 52 or something. There's a bunch of information in there, and then, or you could even just Google it. You could Google chlamydia or whatever I assign you, and just get details about it. So in this concept map, I want you to include, what it is. So you're going to give me a description of what it is. I want some signs and symptoms of it. I want you to tell me how they test for this, like how you figure out someone has this. You could give me some pathophys, that would be nice. And then you're going to tell me basically how it's treated. Any kind of, risk factors someone might have for it. Just like basic important things to know about that STI. So we'll give you guys, let's give you guys a half hour to work on this together. And then when we come back together, we'll share these with each other and see, I could even like post them on here, and then maybe it'll help you later on when you're studying. Does that sound okay?
Yes.
Okay. All right, let me see if I can figure out this breakout room thing. Let's see, we've got 8 participants. So that would be 4 rooms. Okay, this is going to automatically put you in a room, I guess, and I'm not sure who it's going to assign you with. I think it's just going to do it automatically. Let me see what this does. Yes, it did. Cool. Okay. There we go. Oh.
It was saying it would return us to here.
Oh, okay. I did something wrong there. I'll try that.
Yeah, and I think also before we even go
Try that
there,
one
we
more
should
time.
know the STI so that
Yeah,
it will bring
I'm
us
gonna.
back.
I wasn't sure how to do this, so I'm just experimenting here. I'll type in here which what everyone will have, okay, into the chat room here, and then you'll know, and then we'll try it one more time here and see if we can get in there. Did it have a like a time or something in the room when you got
No.
in there? Okay, because it acted like it was going to close everything in so many seconds or something, and I'm like, I don't understand.
Yeah, when it said it was returning us back, it says it was
Yeah,
going
it said we had 60
to
seconds.
work out, but
Oh, I wonder if maybe I have to do something else. Okay. All right, so here we go. So we have Gloria and Lisa. So you guys, let's do chlamydia, which I don't know how to spell that. Is someone good at spelling chlamydia?
I thought it was CLAMYDIA, but I'm not sure. Do it look right?
I know there's an H in there somewhere, but I don't know where.
I don't know. You guys know what I'm talking about. Who cares about my stupid spelling? Okay, so Gloria and Lisa, that's what you guys have, okay? Then Krishna and Tanisha, let's do gonorrhea, which again, I don't know how to spell anything.
Oh yeah, lost me on that one.
I don't think it's
GONORRHEA.
GONRRHEA. Is that what you're saying?
Oh, after the N.
Oh, well, whatever.
Close enough.
All right, so Krishna and Tanisha, you guys have that one. And then Stella and Vera, you guys can do, how about trichomonas? And then Aman and Cynthia, how about you guys do syphilis? Whoops, I'm spelling that stupid. All right, let's see if I can figure this out. Okay. Options. Oh, okay. That works. Yes, that works. I think I fixed the time now.
So,
I don't see you on the breakout. So
well, I don't think I'm on the breakout.
you didn't receive the link.
Yeah, Gloria, can you hear me? There, you're in it now. Okay. There you go. Okay, guys, hopefully you had enough time to do what I asked you to. Did that work with that concept map thing?
Yeah, it was annoying a little bit, but it worked.
Okay.
It didn't work for me and Tanisha.
Okay. Did you just try and make something instead?
We made a whole PowerPoint.
Oh, well, you didn't need to go
Yeah, we
that
made a
far, but
PowerPoint.
okay.
We couldn't figure out how to get, like, we thought when we clicked it, it would just show the whole map like it did before you clicked it, but like I didn't know how to make it to where you put each individual square, like put it together.
Okay, that's okay. So I have this so that people can share their screen. So if someone from each group wants to go ahead and put up what they did, we can share it with everyone.
Call Vernon's email for me.
What's that? Go, whoever wants to go for it.
Is somebody going first?
You can go first. That's fine.
Okay, I was just waiting to see if somebody else was doing it. Okay, let's see.
Get my friend. Oops.
All right. I don't know if you guys can see that.
Yeah, I can see it.
So basically we made this concept map. Let's make it bigger. So basically it's syphilis, and I didn't really know how to like organize it because I kind of went with the template that they already had.
Yeah, that's okay. That's fine.
But so the definition is basically a bacterial infection that's spread by sexual contact that starts as a painless sore. So some of the symptoms are discharge, painless sores. You could have a sore throat. There's usually a rash on palms and soles, but can occur anywhere. And there's other ones, but I guess it just deleted them. So there's like headache, and just like a lot of the symptoms like you can experience, but like they might not show up. So it's kind of like it really just depends, and the best way is to get tested for it. So basically, okay, so to diagnose it, they could do a blood test, they could do a physical examination to see if there's any symptoms. And if you're in like later stages, then they might have to take a spinal tap as well. And you also like usually get screened like during pregnancy because they want to make sure that there's no issues like afterwards. So the treatments for primary and secondary, they're easily treated with a penicillin injection. And if you're allergic, they give you other antibiotics like doxycycline, azithromycin. And if you're in later stages where it's like neurosyphilis, then you can get daily IV penicillin, which makes you have to stay in the hospital. And they can't really reverse any damage that's been done, but it focuses more on like, so you're not in pain. And there's 3 stages. So primary usually occurs 3 to 4 weeks after your exposure or infection. So it's usually a small sore with painless, and it's painless, and it can be infectious at this time, which I mean, it's probably infectious through all stages, but it's highly infectious during the first stage. So secondary, that's where like you could see skin rashes and like more symptoms like a sore throat or headache. And latent is where that's a 3rd stage where the symptoms kind of disappear and you don't even know that you have anything. And then tertiary, which is the last stage, is something like if it's not treated, it can occur years later and cause more like severe damage in that neurosyphilis thing I was talking about. And basically you can prevent it by using protection, getting screened and having your partners get screened, and avoid sharing needles or anything really. And then basically the treatment really depends on like what stage the disease is in and what treatment's going to be used and like what the ultimate outcome is. And then I know they take like if you do have it and the person's pregnant or it's like a newborn or something, then they take like other special considerations as well.
Okay.
Yeah.
Can you send that to me? I don't know if you can save it and send it.
Yeah, probably. I could probably save it as a PDF or something.
Okay. That, because I was just thinking, maybe we can post these online, and maybe it'll help people study or something.
True. All right. Should I stop sharing my screen?
Yes. Thank you. That was
Yep.
good. The whole idea of this is I just thought that sometimes when you talk to someone else in the class, they can help you think of something in a different way. And this, the point in this was to hopefully get you to know the disease process that I gave you better. So hopefully it sticks with you in your head a little bit more when you're looking at questions about it. All right, who else wants to go? Tanisha and Krishna, you guys can go if you want. That's fine.
Can we go?
Yeah, whoever wants to go next, go for it.
Vera? Okay, so we got the trichomonas. I don't know how to say that, but
Trichomonas?
yes.
Okay.
So part of the description that we put on there, me and Vera, is that it is sexually transmitted, and it's caused by.
Can you
What?
can you share your screen?
Oh hell yeah!
Try that. There we go. Okay, now we can see it.
Okay. So hold on, let me put this side so you can see it properly. Okay. Better. Hold on. Okay, so for the description, we had that it is a commonly sexually transmitted infection that is caused by a parasite known as the Protozoan T. vaginalis. I don't know if I said that right.
Okay.
Signs apparently for the signs and symptoms, it happens both in men and women, but there's more signs and symptoms in women than there is in men. So it says that there is usually no symptoms in men. But for women, they see like signs like abdominal pain, swelling around the genitals, painful sex, blood in vagina, bad smelling vagina discharge. And then diagnosis. So they say they diagnose this by taking a sample of the urine or fluid from the patient's genitals and looking at it under a microscope to spot the parasite, the T. vaginalis. Sometimes they do a culture for it too. Pathophysiology, we put that it inhibits the vagina and uterine tissue. Risk factors. So some risk factors that we found was that if a person has like multiple sexual partners, unprotected sex, or if you have a history of STIs, so you're more at risk of getting it. And for the treatment, there are basically two medications that we saw in the book. It says metronidazole, which is flagyl and noritate. And then the second one was tinidazole, Tindamax. Yeah, that was it. Val, you want to say something? Never mind. Okay. Yeah, that was it.
Okay. Can you save that and send it to me?
How do I do that?
So you basically have to sign up for a free account. So you just like enter your name and then your email and then you save it. It will only let you save it as like a PNG, but I just downloaded it and it's still pretty clear. So you just have to sign up for a free account.
Okay, I'll try that. Thank you.
Okay, so you can go ahead and stop sharing your screen and we'll see the next group. Okay, who else wants to go? We got two more groups left.
I can go.
We'll go.
Okay.
Um, where am I?
See if you can share your screen.
Okay. We had a chlamydia. We know it's an STI. It's common in both men and women. In women, it affects the cervix, rectum. Chlamydia can also affect the throat and the eyes. Same applies to men. It can also be transmitted through childbirth. That is for a baby to get it. That's how it'll be transmitted to a baby. In women, the signs and symptoms, there's a burning sensation during urination, painful intercourse, vaginal discharge, pain in lower abdomen. There is an inflammation of the cervix, and there is some bleeding in between periods. With men, there is also the same burning sensation. There is yellow or green discharge from the penis. Same pain, um, lower pain in the lower abdomen, and there is pain in the testicles. For chlamydia, if it affects the throat, the symptoms that you would find are there is actually painful sore throat, dry throat, fever, coughing. In the eyes, there is redness, there is itch and irritation, mucus or discharge from, how do they even call it? The lacrimal ducts, I guess. There
Oh,
is,
the lacrimal ducts, yeah.
yeah. There is light sensitivity to the eye. Some lab tests are, of course, the urine test and also the nucleic acid amplification test, which actually takes longer for you to get the results. Risk factors in women, if it's not detected fast on or not treated on time, it can spread to your uterus and the fallopian tubes, which can cause a disease called a pelvic inflammation disease. It can cause infertility, or even if you get pregnant, it's going to cause you to have an ectopic pregnancy. Um, with men, if it's left untreated, same, you're going to end up having epididymis, which is the inflammation of the testicles, causing excruciating pain, actually very unbearable. And I think, based on what I found, if it ends up spreading to your prostate gland, sometimes it can cause prostate cancer. I'm not sure if that has been researched or not. With babies, like I said, they can only get it through childbirth from the mother. With treatments, you can treat it by antibiotics, which is azithromycin and doxycycline, which we already learned about. Some home remedies, because some people like to treat it at home. You can use the golden seal and the echinacea plant. So pretty much they apply it by inserting, the juice from the plant into their perineal areas. Prevention, of course, protect yourself using condoms if possible. Avoid oral sex and get tested regularly for STDs, you and your partner. So that's what we got.
Okay, thank you.
Okay.
If you can send that to me, I'll post it on our page.
Okay. Now let's see how to stop sharing this here. Oh. There will be a problem now. Not yet. Eventually, I would escape. How do I stop sharing this?
There should be
it's right there.
Yeah, there you go. Okay. All right. How about Krishna and Tanisha? Go ahead and start sharing your screen. There we go.
Okay, so we did our PowerPoint on gonorrhea. So the first one was, what is it? Gonorrhea is caused by I don't know how to say this, the Neisseria gonorrhoeae. It's a gram-negative bacterium. That's usually what causes it. It can be transmitted by exposure to sexual fluids during vaginal, anal, or oral sex, but ejaculation does not have to occur for gonorrhea to be transmitted. Some risk factors include sexually active women younger than 25. Men who have sex with men are at increased risk for getting gonorrhea. Some other factors that can increase your risk for getting it is having new sexual partners, having sexual partners who have had other sexual partners, having more than one sexual partner, and having had gonorrhea or any other sexually transmitted disease or infection. Signs and symptoms. The initial site of infection in men is usually the urethra. Many men with gonorrhea, they're usually asymptomatic, and many others report that they also feel symptoms. The most common symptom of this is the I can't say this, the urethritis.
Yeah, that's probably right.
So it's just like inflammation in the urethra among men. So that when they have this, they feel like burning with urination, purulent discharge. Most women who contract gonorrhea are asymptomatic as well, or they have minor symptoms that are often overlooked. For women, common symptoms are increased vaginal discharge, painful urination, frequency of urination, or bleeding after sex. Often redness and swelling can occur at the cervix or urethra along with the purulent exudate. And so like, I think that they call gonorrhea the clap because of the purulent discharge that they have. Testing. So testing, the diagnosis of a sexually transmitted infection requires an accurate sexual history, a physical exam, and appropriate laboratory tests specific to each infection. For men, presumptive diagnosis of gonorrhea is made if there is a history of sexual contact with new or infected partners, followed within a few days of urethral discharge. For women, making a diagnosis of gonorrhea on the basis of symptoms is difficult because most women are asymptomatic or have complaints that may be confused with other conditions such as chlamydia or UTI.
Wow, that's kind of scary.
Yeah, and I feel like a lot of these STIs like have like the same symptoms when it comes to UTIs. They like resemble a UTI a lot, so you just never know, I guess. So treatments. Because of the short incubation period and high rates of ineffectivity, the treatment of gonorrhea is often given without waiting for positive test results. The first line of treatment for gonorrhea is usually dual therapy with Rocephin, which is given IM with oral zithromycin. I don't know how to say that.
No, you're right. You're right.
Instructions on abstinence from sexual intercourse and alcohol drug therapy or alcohol drug treatment. And well, they do the alcohol and drug treatment because they feel like when you're more likely to have sex after you have alcohol and drugs because of bad judgment making.
Okay.
And then they have re-examination of symptoms if it persists, or because they want to see if if the drug therapy worked, or if it's going to reoccur after the completion of the treatment. And then that's it.
Good, nice job. All right, so if you could send that to me, that would be great.
Okay.
All right, so hopefully this helped a little bit, you guys, that you kind of know a little bit more about the one that you were assigned at least, because it seems like there's 3 million different sexually transmitted infections, and a lot of them have a lot of similarities and stuff, as you could see. So what you need to do is to try and pick out something that's significant in each one of these to make sure you remember it, so that if you get tested on it, you were able to pick it out, you know? Like that, I forget which one it was that one of you guys said that men have like a weird color discharged or whatever, like that's green or whatever. That would be something probably significant because you don't see that with every one of these, you know? And then like, you know, different, the way that you treat some of these. So some of the treatment is different, you know, compared to others. So, you know, those are some of the things I would kind of try and focus on. So, I looked at the test briefly. Your test is gonna be like 60 questions when you have it, that first test. And they kind of, I mean, the breakdown of questions is pretty not too bad. Like this stuff we just talked about, the sexually transmitted diseases, I think there's probably like 6 questions on that. And each question, pretty much each question's on a different sexually transmitted infection, you know? So they try and like hit everything a little bit. And then like some of the stuff we talked about in the first week that, you know, like the teaching and the culture stuff and all that, that's not going to be as heavy on the test. So you may see like 1 or 2 questions on some of that kind of stuff. But yeah, so the breakdown isn't too bad. So I will probably look at that again. I don't know if I'll have time this weekend or not. If I do, I'll go ahead and send you like a tips for your test or whatever coming up. So I'll get that done here pretty soon for you. Did you guys have questions about anything from this week's stuff that you looked at?
I do. It's not a question on like what we've done, but like coming up, I see ATI fundamental something in the syllabus the day that we have the exam. Can you just elaborate on that a little bit?
Here, is it the practice test that's due? Is that what it is?
I think it do say ATI fundamentals practice or something.
Yeah, it's like the practice.
Yeah, whatever.
So basically, you just go to ATI and you take the test. And when you're done taking the test, you print out the printout for it. And the printout will tell you a bunch of stuff. So in the like right top corner, it'll tell you a percentage that you got right. So like maybe it'll say 76% or something. And then it breaks everything down into categories. So it might be like, hey, these are basic comfort questions. These are, I don't know, prevention of, or health promotion and prevention questions or whatever. You know, they have all these different categories they break it down into. And then as you keep going through the printout, it'll tell you topics to review. And that's what you need to pay attention to. So you look at your topics to review, and you also look at that percentage that you got right on that first page. And so remember on our addendum, you look into the addendum and it'll tell you, hey, if I got this percentage to this percentage, this is how many active learning templates I need to do for remediation. I have kind of an example of someone who did one before that I'll see if I can post that so you can look at it for maybe that'll help you understand what I'm talking about more.
Okay, and this is so off topic, but you just saying I have an example just reminded me of a question that I've been wanting to ask you for a while.
Okay.
So I don't know about everybody else, but I don't know what I'm doing wrong as far as care plans. So do you have an example of a care plan that someone got an A on? Because I don't know what, as far as information that I put wrong in the care plans. And I know we have care plans coming up with what's her name for the lab for this class?
Oh, are you talking about Mrs. Kovach?
Yeah, she said something about we gonna have to do care plans and stuff, and I just want to see one that was like correct, because
so that may not. I'm gonna look at you guys' stuff again. You may not have to do that, so don't worry about that. The only thing we were thinking about doing is if you did that, it would just be like a practice thing, so you can get better at it. That was what our idea was.
Oh, okay.
So it's not like for a grade or anything like that. It's, you know, to help you get better at figuring that stuff out.
Okay.
Okay. So anyway, I will see if I can post a thing to show you about the ATI stuff we were just talking about. I'll see if I can post that so you can see, you know, what's
Okay.
what with that.
Okay.
Is that next week that's due?
It's week 4.
Week 4. Okay, so the following week. Okay. All right. Yeah, I'll post that, and then everyone take a look and see if you understand what you're supposed to be doing. And if you don't, please ask me so that we get you on, you know, the right track with what you're supposed to be doing. Because I get it. I mean, I know you guys haven't done that before, so it's fine. All right. Anything else? Okay.
Hi, so can I stay on Zoom with you for like maybe 5 or 2 minutes? Because I wanted to show you something on my screen when the class is over.
You want to show me something after class is over? Yeah, that's fine. I can stay on here for a minute when everyone else goes. Sure.
Okay.
We're not coming back, right?
What's that?
Are we coming back?
Well, that's what I was just going to say. I don't think we need to today. I think we're pretty good for today. So what we're going to do then, we're going to plan on coming back for lab. What time's our lab start? 12:30, something like that? Is that right?
Yeah, I think so.
Okay. So plan on coming back here at 12:30. We can just use this same Zoom meeting. That should be fine. I shouldn't have to call a new one for that. And so when you come back for lab, remember this week was supposed to be, you know, us talking about injections. So make sure you review that stuff, because I'm going to ask you guys specifically about certain things with those. I want you to be able to tell me that you know some of that, okay? So we won't, you know, we shouldn't be on there for a super long period of time in lab. I'll just do a little bit with you guys and then we'll get off.
So the modules for lab, that's module 6, that's due on Sundays, correct?
I think, I'm off the top of my head, I couldn't tell you.
Okay.
I'd have to look at it. I have so many things I'm looking at all the time. I don't know. But yeah, whatever the due date is on our lab schedule that I gave you guys, that's what it is. Okay. All right. So everyone can go ahead and get off here. We'll go ahead and come back at 12:30 for lab.
Thank you.
All right. Thanks. I'll stick on here for a second, Vera. I'm still here. Did you need to ask me something?
Yeah. Give me a minute.
Okay.
I'm trying to log in and show you my screen. Okay, so like let's say like the older adults, right? It's saying that I should print the growth and development template. Yeah, so for that one, do I put like older adults, and do I have to put like the the one that is saying responding to client's concern, or just focus on the older adults?
You're just focusing on the older adults for that template. Yeah.
Oh, okay. Because I kind of like had like a SAP thing.
'Cause-
So
Do you see how it says responding to a client's concerns about retirement? That's what you're focusing on.
Oh, so that's what I'm focusing on.
Yes.
So about retirement.
Yes.
Okay. So like let's
So-
say for
You know how when you look at that template, there's a ton of stuff on there. Like you can fill out the other stuff, that's fine. But your main problem with whatever you got wrong had to do with this.
no, okay. Okay. So like let's say for the legal responsibilities, I have to focus on the teaching about declining resuscitation.
Yeah.
Okay. Yeah, that's all I wanted to ask.
Okay, that's no problem.
Thank you.
Sure. All right, I'll see you later.
Okay.